Okay, we're on.
Okay, so here is Murphy. He's doing quite well, very happy. We found today that he did have some discharge coming from the areas where his ribs were attached to his splint, which is not surprising. It was a little bit of a superficial infection, so we did take his body cast off today. What we found when we took everything off is that he actually had very nice lung sounds. So prior to surgery, the entire lung on the left side was collapsed and there was no air going to that lung. Now when he takes a deep breath, you can actually hear air all the way in the upper part and in the lower part of his chest, which is fantastic. The other change is that this whole portion of his chest wall was inverted, almost looked like a cave, and that was the purpose of his splint. So now that that is off, his chest is in a nice normal shape. We took the sutures out, cleaned all of the skin. He just has a very superficial irritation infection, which will be should be much improved by tomorrow. And then instead of putting a cast around his body, we made a donut. So you can see there's a big circular shape here. And what that is it's a donut type bandage that keeps pressure off of his chest wall. So if he lays on this side, the bandage is what's touching the floor, touching the table, not his actual ribs. And so tomorrow we're going to take the bandage off of him, check all of his wounds, and they're just very tiny. It's just where all the sutures were pulling on his skin, so not surprising. But I'm very happy that his chest has maintained its conformation from the splint. So far, doing excellent.
Awesome.
Yep.
And the coughing?
So coughing could be from a multitude of things. He does not have any evidence of pneumonia, which is perfect. The sutures that he had going through the splint were going into the chest. And that's something foreign. So that's enough to cause an irritation for him to stimulate a cough. His cough is not very frequent, and it's not productive, meaning he's not coughing up material. So now that the splint is removed and the sutures are out of his chest causing that irritation, I'm going to see how it changes. But ultimately, I'm not overly concerned about his cough at all.
Okay.
He has a reason to have a little bit of irritation.
Perfect. Okay, great. So that's clear, out of the way.
Yes.
That's Murphy.
Check.
Murphy check.
And he's doing his fractures, almost healed. He still is on exercise restriction, but I think he's ready to go to a home when we find one.
Okay.
And he's otherwise happy. We started his first set of vaccines already. He's gotten dewormed.
Oh, good.
Yeah.
So you gave him the first set?
We did.
Awesome.
Yep,
That's what my
we did.
concern was too.
He's got a great appetite. He likes to play.
He loves that antler I just brought him today.
He does.
Awesome. Okay. And then Kindred.
Kindred, do you want to bring her in?
I would love that
Okay.
if possible.
Yeah.
Oh, that would be great.
So do you want to visit with him more?
No, because I'm going to come back tonight.
Okay, so let's go switch them out, and then we'll.
Thank you both.
We'll be right
Thank
back.
you.
And then I had her Stacy on my phone. But
Okay.
what was her like?
Okay, guys, so that was Murphy. And now Tammy and I are waiting for Kindred to come out. We just have so many questions, and it's so confusing with the phone calls. So we wanted to get it all here for all of you to see and understand out of the doctor's mouth, not our mouths. So they'll be bringing Kindred out any minute now. So just kind of hang tight with us.
Please.
Hold, as Tammy always says, hold please.
He looks great though.
He does look great.
He's so cute.
Such a good boy.
He's been through a lot.
So much for a little puppy. So much for any dog to have to endure. I'm so grateful.
I'm grateful that he brought him to IMP and not to a different vet's office. because
Or
the
shelter.
outcome
Or a
could have
shelter.
been-
He would have been euthanized immediately.
The outcome could have been much different.
Majority of rescues can't take on a responsibility like that. It's just too.
I can't
It's
imagine what.
yeah. Well, they told me that the bill was $16,000 and it's still going. Hi, Kindred. Hello, my beautiful.
I saw her the night she came in. She looked so much better.
Right?
And you smell better. Did
And
you
the
get a-
tail.
Yeah.
All right, so.
Nice.
Skinny mini.
Okay, so Kindred, basically, she came in because she was found on the side of the road or found in a parking lot.
Yep.
And she had this very large swelling near her vulva area under her tail. Initially, they thought she could have had a hernia because clearly she's had a lot of puppies, and that's a common problem with these dogs. But when we examined her, we actually found that this large mass is actually a tumor. and it's a tumor called transmissible venereal tumor, which is almost like a sexually transmitted disease in dogs. And the good news is that once it's diagnosed, the treatment is actually by giving them a chemotherapy drug. And the medication that we give is called vincristine, and after one dose, you can see almost complete resolution of the size of the mass.
Wow.
Yep. So for this particular condition, we wanted to get her to a little bit better of a body condition. She, of course, is very thin. Doesn't have a great nutrition balance. She's emaciated. She's not vaccinated. So for the last week or so, we've just been treating an infection in that area and then giving her food. She's already gained quite a bit of weight. She has a great attitude. She feels good. And we checked her blood work today just to make sure that things are improving. And most importantly, her protein has improved quite significantly. And also her white blood cell count and red blood cell count are normal, and that's important for this drug. So the plan is we're going to give her first drug today, her first dose. She's going to get a repeat in 1 week and then probably one additional, and that's hopefully all she'll need. So we are excited to see how this changes. It should go down in size quite dramatically, and hopefully we can completely treat this tumor without having to do any kind of surgery.
Awesome.
So once she's after she gets the drug, she may have some discharge from the back end, and that could be a little bit messy. So she's going to have to stay with us until we make sure that that area stays nice and clean. But ultimately, she can go to a foster as soon as we deem that's under control. And she, so far, has been a really great dog. Very friendly, very outgoing. She does seem to be a little bit dog aggressive, but most street dogs are because they fight for food. So we haven't really appreciated her going after dogs in the cage.
Yes,
A little bit, yeah, a little bit. But, I think that we can probably work that out a little bit better once we do some behavior assessment with her. But she's great. She's a really sweetheart. And then once this is all treated, then we can talk about spaying her and doing all of that in the future. But we want to get this under control.
Okay, great.
So that's it. She eats like you wouldn't believe.
will the chemo make her sick at all?
Well, the biggest thing is that any chemo can make them feel a little bit nauseated, but the biggest thing is it can make their white blood cell count drop. So we'll be watching her for any signs of not feeling well, lethargy, and then prior to giving her next dose, we'll check her white count and make sure that she's still stable.
She's nothing but
I think
love.
she feels quite lousy from having this.
Yeah.
It's very irritated. It's infected. It's painful.
It always drips.
Yeah, because it's infected. So I think once that is improved, she's going to feel much, much better. I mean, her body's really been fighting to treat this infection, and that's using all of her reserves.
And are you still flushing it, or you don't have to
We
flush
are,
it?
yeah. It's, actually today is the first day that she really hasn't had that much of an odor. A few days ago, you would just walk into the room and you could smell it from a mile away.
Death. It smelled like death.
Yeah, so even when you look at the tissue, it's nice and red today, whereas before it was, green and had a pretty significant thick discharge. But she's sweet. She's very happy.
Hi, baby.
We've been happy too.
So today's the day we're going to start the treatment on
Yes.
you. All right. So I think we're good, right?
Yeah. Yeah,
Thank you so much for taking the time to
of
explain
course,
everything,
of course,
Dr.
of course.
Blvd.
Yep.
Just
We
makes
also, we're
things-
not vaccinating her yet because
Right.
we're challenging her with the chemo.
Sure.
Yeah. So
That's,
we did
I was going to
deworm
ask
her.
you that.
Hi.
Hi, baby girl. I love you too. Awesome. She's had a horrible life for sure. They did say something about when we first brought her in that there were all kinds of bones in her belly and
Yeah, typical
Oh,
street dog.
the street dog.
Yeah, I haven't repeated X-rays. There's no reason to do that. She's
Okay,
passing
good.
everything, and her
Awesome.
stool's normal. Don't let her lick your face because
Yeah.
of this
I
tumor
keep
that she
telling
has.
everybody,
Wipe
nobody's
your-
listening to
You
me.
want to go to wash your face.
Yeah.
But she did we documented she had worms, so we treated that. So she's completely dewormed, and once we're done with the chemo, then we'll vaccinate.
Perfect.
Yeah.
Perfect. So guys, there you have it.
All good news.
Thank you so much.
welcome.
And we'll just visit with her for a few minutes.
Sounds good.
and
Just bring up front when you're done.
Awesome.
Okay, thanks, guys.
Thank you so much.
Yeah,
Yeah, that's a good idea. Go wash your face. Stay here, Mommy. Stay here. Thank you. Oh, gosh. Okay, guys, so there you have it. We have our update. Where are you going, Moms? On Kindred and Murphy. We are getting ready to get the estimate together for the painful part. the estimate together for Kindred's treatment plan and then Murphy's ongoing care here. So we are so relieved and we're so happy and that this can all be treated and it's treatable, and we're so relieved right now that the sound of no surgery for Kindred is just so fantastic, minus when she's ready to be spayed, which that will absolutely be done in her vaccines and microchip and all that. So we just have a long road ahead of us for the care. Again, we are going to be meeting with Dr. Z and Ellen to go over the estimate for the care, and then we will be posting our vet bills, which we are going to ask, please, for your support to allow us to do this and take care of Kindred and Murphy. So we can't do it without you. So anything that anybody could donate towards their care would be so greatly appreciated. And again, we're going to be going over that in just a little bit. These doctors are fantastic, and they're the best. And that's why these dogs are here. And along with that is the cost. You get what you pay for. You really, truly get what you pay for. So in order for these dogs to get what they need, then we're going to need your help by please donating. We will add the PayPal link, the mailing address for donations to cover their cost, and give these beautiful dogs the chance at a real life without pain and suffering and being tortured on the streets. So thank you in advance to all of you, our supporters that are watching, and this is our update for today for Kindred and for Murphy. We'll keep you posted as we go with the treatment and how they're doing, as we do with all of our rescues. This is Amy and Tammy with Kindred signing off for now. 100 plus abandoned dogs of Everglades, Florida.